Well, health experts say that they are concerned about a rise in colon cancer for young adults. Colon cancer is now the deadliest cancer for men under 50 and the second deadliest for women under 50. Yet 80% of adults ages 45 to 50 are not getting screened. Joining us live this morning is gastroenterologist Suhail Salem with some insight for us. Dr. Salem, good morning. Thanks for joining us.
Thank you for having me.
Screening saves lives, but why is it so vital when it comes to colorectal cancer?
Screening is really the key to beating colon cancer. Colon cancer is one of the most preventable and beatable cancers as long as we catch it before the onset of symptoms. And that means that, if we have tests to check for colon cancer early, if we detect it, we can undergo surgery and remove the tumor before it spreads, and we can prevent colon cancer by removing precancerous polyps from the colon during a colonoscopy. And that's how we prevent colon cancer. So it's very essential to beating this cancer.
And for a lot of patients, they know that these symptoms don't show up until the later stages, which is why it's so dangerous. What are some of the symptoms that you may notice?
Symptoms include rectal bleeding, changes in bowel habits, abdominal pains, unexplained weight loss, anemia. Those are all possible alarm symptoms that you should get checked right away.
Risk factors, what should people know if they're watching this morning that you can pass on?
Okay, so risk factors include a diet high in red and processed meats, too much alcohol, smoking, a sedentary lifestyle, and a diet low in fiber, not enough fruits and vegetables and whole grains, too much sugar. Those are all possible risk factors for colon cancer.
So I mentioned before we came to you, it's now the deadliest cancer for men under 50. When should people get tested and how often?
Everybody should begin testing at age 45 now, men and women both. If you have a family history or other risk factors for colon cancer or certainly symptoms, you should get checked earlier than 45. It's once every 10 years, as long as it's normal. If there are risk factors or precancerous polyps, then it may be more frequent than every 10 years. But for everybody, at least once every 10 years from 45 all the way up to 75, 85.
And Dr. Salem, what do you say to the people, the patients who are apprehensive to get checked, to go through the process, leading up to the procedure?
Well, I would say we have more options than we ever did before for screening. We have at-home stool testing. We have colonoscopy, of course, which has been around. We have better preps now than we used to. There are probably going to be new tests coming out on the market that are blood-based. So there are more options than there ever were before. This is a cancer that is everybody is at risk for as we get older, but it's one of the ones where it's completely preventable and beatable as long as we get screened. So we all get older, and this is something that we should do to take care of ourselves as we age.
Good insight. Before we let you go, where can people go for more information?
Well, the easiest place is just talk to your primary care doctor. They can help link you with a gastroenterologist, or they can order at-home stool testing for you directly. That's probably the best way to go. And then there are resources online through American Cancer Society that are also excellent.
It's good to build the awareness. Dr. Suhail Salem, thank you so much for coming in. We appreciate it.
Thank you.